This time last year, there was no vaccine, hospitals were overrun, and staff were stressed.
If you love your family, your friends, your community, help us fight this infectious virus.
I think that we're going to get through this. We just need to stand together.
Stay at home because we can't stay at home.
I probably had hoped we wouldn't be here again, but deep down thought that we would be. As a person, as a patient, as a dad, as a doctor, and I really wouldn't want to go through this ever again. We're hoping this is our pandemic for our generation.
Dr Trubiano says he feels like he lives at the Austin Hospital.
I don't think we've got the mental strength to go through a wave 4, to be perfectly honest. We did about 21 days straight again in the last stretch. We've got more patients now than we had during wave 2, and it's likely to get worse.
As of last week, Melbourne is out of lockdown, but COVID is still rapidly spreading amongst the unvaccinated.
We've got 4 going on 5 wards full of COVID patients. They're much sicker than they were in wave 2. They're younger. Their mothers, brothers, fathers, all admitted together. They're scared, they're frightened, and they're unvaccinated in the vast majority.
We've only had one person who's been fully vaccinated, and they had other health reasons which caused their illness, really.
Dr Workload says it's common for COVID patients to spend a month in the ICU.
So I've just entered into Pod D and Pod E, which are 2 of our COVID-only pods. This is one of our sickest ICU patients.
I think one of the hardest things has been having patients who were not vaccinated, who were really frightened of getting the vaccine, who then developed COVID, and just seeing the fear and the anxiety in their eyes. I've had some of them say to me as we're about to intubate them, I wish I'd had it. I wish I'd known how serious it could be. And now I'm terrified that I won't see my family again. It breaks your heart.
There are still more than 22,000 active cases in Victoria, and 746 of those people are in hospital. Sadly, 25 COVID patients died yesterday.
Being on a ventilator is not the only thing that happens here. They've got lines and tubes in almost literally everywhere, and it's an incredibly impactful and burdensome thing for a person to go through. Most of our patients will survive, thankfully, with a lot of hard work, but they'll still never be quite the same again. The legacy of COVID and being critically ill will leave an imprint on their lives forever.
It's so busy at the Alfred, around 20 extra nurses are joining the COVID response team every week. Courtney Barron trains them.
You've got nurses who have not had a holiday or a break in 12 to 18 months, but are still fighting the same fight, and that's really hard. My cup is definitely empty, and I think going into work, and I try to be the happiest person I can be to make that a bit easier and to try and fill anybody else's cup.
As we can see, we've got quite a lot of consolidation going on throughout the thoracic cavity here.
Courtney is in 2 minds about lockdown being lifted. She expects the next few months to be her busiest yet. But she's thankful nurses will have a life outside of work again.
I know the impact that this has. I know that it's going to increase. However, again, if we're filling up those nurses' cups, they're going to be feeling better and stronger to come in, fight the battles, get in the trenches and do what we need to do.
There's a lot of exhaustion throughout the nursing staff, the medical staff and the healthcare system as a whole. But I do think that we do have a light at the end of the tunnel here, and this surge hopefully will be the last of these major surges that put strain on the healthcare system.
Professor Peleg is in charge of keeping hospital staff safe. It's a huge role, but could be a lot easier if more people were vaccinated.
A lot of people have said this is a really bad flu, but I must say, come and spend a day with us in the wards or in our intensive care. Getting vaccinated is the single most important thing you can do to prevent you from having very severe disease.
Jason, Stephen, Courtney and Anton agree. Watching people leave hospital after beating COVID makes what they do worth it. But after 19 months on the front line, they've had enough.
I want to go to the park, take my kids to school. Yeah, it's very tough. Yeah, they're amazingly strong. And so it's been very difficult for them.
If you have anybody that works in healthcare, that works as allied health or spotless, send them so much love, because I can guarantee you they need it. We all need it. Yeah. It's actually you get quite sad about it, because it's actually such a shit time. Yeah, no, I am, but it's just it is. And I think if people saw that... you can get that. That's raw, that's real. It's a scary place, it's hard.
It's really hard watching that, isn't it? When you think about all of those frontline workers, they don't do that because they get great pay. They do it because it's a calling, and they do it because they care. And when we all heard today that there were 25 deaths in Victoria, you know, those healthcare workers have been there, they've held those hands, and they've watched those people pass away despite their very best efforts and the very best healthcare available. And even when you look at that footage, you know, most of those people in ICU, they've got 6, 8 healthcare workers around them. The whole thing is just so incredibly sobering.
And they're there for ages. That's the thing. It's not like a normal ICU situation where you're in there for a few days. It's,
Our thoughts go out to everyone affected right now.